these little connections, these feet or wires that the brain cells put out. So we think that it has a role in communication between one brain cell to the next. But we also know that it's actually present in a lot of other places outside the brain. It's in red blood cells, so the cells in your blood that carry oxygen. It's in different immune cells, so the cells that fight off infection. And actually, if you take out this protein from mice, those mice are actually more prone to developing infections. So this protein is involved in a lot of different things, but in brain cells, we think it's important for communication from one cell to the next. And we don't know why this protein clumps together. We certainly see it in the brain, but now, and I think I mentioned this a little bit last time, but we also see this clumping outside the brain. We can find it in the skin, we can find it in the intestines, we can find it in the nose. And we don't know if it starts there, or if it starts in the brain, or if it starts in the brain, spreads to other places, or kind of starts all over at the same time. So that's an active area of research right now. But what we do know is that there are certain genes that are definitely involved in causing Parkinson's disease. And actually, one of the reasons we are fairly certain that alpha-synuclein is probably playing a big role is that there are families where they actually make a lot more alpha-synuclein than people that don't have that change, that mutation. So there are in some families, people make 3 or 4 times as much of this alpha-synuclein protein, and they develop Parkinson's disease very young. So when they're adult, like during puberty or in young adulthood, and it progresses very quickly. It's very rare. That's very rare, but there are families where that does happen. And there are a few other genes that's pretty similar that it's involved in the processing of alpha-synuclein, we think, and it causes a very early and aggressive type of Parkinson's disease. And then there are other genes that are involved in mitochondria function. And what the mitochondria do they produce the energy for the cell. So in our cells, when we eat something like sugar, the mitochondria take that sugar and produce energy for the cell in a form that it can use. So genetic changes that affect mitochondria, they also cause our brain cells to not work properly, and they cause them to die, and can cause symptoms of Parkinson's disease. But interestingly, some of these forms that have these mitochondrial changes, they don't have these clumps of alpha-synuclein. So it could be kind of a different pathway or a different path to getting to the same disease. Does that kind of make sense so far about how we kind of get to what we understand about the genetics piece of it?
Yeah, substantia nigra, is that something that exists at all times, or it develops because of Parkinson's?
No, so it's there all the time. That region of the brain is there as your brain normally develops. It does. The only thing that changes about it is as everyone normally ages, is that it gets more and more pigmented. So if you look at the substantia nigra of someone who's 90 years old versus someone who's 30 years old, the substantia nigra of a 90-year-old is going to be very dark and pigmented.
Now the MPTP, you said young people develop some symptoms. Explain to me again what the MPTP does?
Yeah, so the MPTP was a byproduct of basically poorly made heroin.
Poorly made what?
Heroin. Yeah. So people were making heroin in their basement in their homes, and because they weren't doing it properly, it was basically a contaminant. And then that we know that chemical can cause these cells in the substantia nigra to die, and made it so that those individuals had what looked like Parkinson's.
Question. So bradykinesia tremor, postural instability, and stiffness. Those are the 4 symptoms of Parkinson's.
Yeah, the 4 main symptoms.
Okay, 4 main symptoms. Are there others that you need to tell us about?
Yeah, so there are a lot of symptoms of what we know about now about Parkinson's disease, and we know that now that Parkinson's disease probably starts decades before you develop these symptoms. So there are symptoms like constipation, loss of sense of smell, acting out your dreams in your sleep. All of those can be symptoms that happen before you develop movement symptoms of Parkinson's
What did you
disease.
say about dreams?
Acting out your dreams in your sleep.
Oh, okay.
Acting out your dreams while you're sleeping. And then there are other things like anxiety, depression. Those symptoms can also happen before you develop Parkinson's motor symptoms, movement symptoms of Parkinson's disease. But it's difficult because all of those other symptoms are non-specific, right? They're they commonly happen to other people that are not going to develop Parkinson's disease. And then as Parkinson's disease progresses, there are a lot of other symptoms that can develop, but usually after you've developed these movement symptoms, and those things include trouble controlling your bladder, lots of trouble controlling your blood pressure, people getting very lightheaded to the point that they pass out when they stand up, hallucinations, trouble with thinking and memory, trouble emptying your stomach, so getting full really early after you eat. So all of those things suggest that Parkinson's disease is this whole body problem and not necessarily just a problem with this part of the brain. But how we've been thinking about and how we diagnose Parkinson's disease is all based on this small part of the brain. And that's kind of changing. People are now thinking about how do we better define Parkinson's, and part of that is based on measures of alpha-synuclein in the blood, in the spinal fluid, in the skin.
You're saying that there's a clinical test for alpha-synuclein?
Yeah, there's 2 of them that have been recently FDA approved, and when I say recently, in the past year. So one is a spinal fluid test. So if you've had a lumbar puncture or a spinal tap, what we do is we take a small needle and go in the lower back, take a sample of fluid from the space that surrounds your spinal cord, and we can send that off for testing to look for an abnormal form of alpha-synuclein that likes to stick together and clump together. And then we can also do a skin biopsy, and we actually look under the microscope and look for abnormal clumps of alpha-synuclein in the nerves that are in the skin. So those are the 2 clinical tests for alpha-synuclein right now.
Last week, last Monday, I had an appointment with my neurologist, and I was diagnosed a year ago with the very early stages of Parkinson's. What I learned from my last appointment is that it's not definitive that I have it, but the doctor said that there were evidence of subclinical strokes in my brain. What does that mean, a subclinical stroke?
Yeah, so what a subclinical stroke means is that you had a stroke in the brain, but you didn't have any symptoms of it. And that can happen. That happens all the time, and that can be some level of it is normal as we all get older. And then if you have conditions like diabetes, high blood pressure, high cholesterol, it becomes more and more. You can develop more and more subclinical strokes over time. And sometimes those subclinical strokes reach a certain level that they cause symptoms, not because of the individual strokes themselves, but as the damage to the brain overall. And you can kind of think about it as similar to you think about heart disease. You can certainly have a massive heart attack where you have crushing chest pain, you have trouble, the heart has trouble pumping, so you kind of collapse and you lose consciousness. But also some people develop heart failure over time because of small damage to the heart over time. And so that's how you can think about these subclinical strokes. It's small damage to the brain over time. Sometimes that small damage can lead to trouble with thinking and memory. Sometimes it can lead to trouble with walking that looks different from Parkinson's disease. Sometimes it can lead to trouble even with just, the only symptom can be controlling your bladder. And sometimes it can make it look like you have Parkinson's disease. It all depends on where those subclinical strokes are happening. And sometimes it can be tricky to figure out, is it from how much of it is from subclinical strokes, how much of it is from maybe an alpha-synuclein related process, or a process that's affecting your substantia nigra independent of either of those things. But yeah, you can certainly ask your doctor about the test for alpha-synuclein, or imaging. I don't know if you've had a DAT scan, which is a scan that looks at how dopamine, the chemical that's produced in the substantia nigra, is handled in the brain. Question?
Other causes, like concussions, trauma to the brain?
Yeah, so that leads me to my other two buckets. So bucket 2 and bucket 3, and I've put it in this order for a reason. So bucket 2 are genes plus environment, question mark. I'm going to say risk genes, and then third bucket, which is genes plus environment. Okay. So the difference between these two buckets is that there are certain genes that we know of that definitely increase your risk for Parkinson's disease. And so probably the two most common ones are a little bit of alphabet soup, but LRRK2 and GBA, or glucocerebrosidase A, or alpha. And these, so GBA, if any of you have heard of Gaucher's disease, GBA is actually the mutation that causes Gaucher's disease. It's an inherited disorder where you don't handle breaking down fats in your body as you normally should. But people that carry, and normally you have to have 2 copies of this abnormal GBA gene in order to develop Gaucher's disease. But if you have only 1 copy, you're at a much higher risk of developing Parkinson's disease over your lifetime. But that risk varies widely. So there could be, there are some people that live their whole life with this same gene and don't develop Parkinson's disease, but some that develop it very early in their, before they're 40 years old. And we still don't understand why that happens, but we think it's probably related to either some other genes that they have, or how their environment is different from another person that has the same gene. And the same thing goes for LRRK2. And these LRRK2 also, for example, is particularly more common in people that are of Ashkenazi Jewish descent or North African descent. And again, these people are certainly at a higher risk of developing Parkinson's disease, but it varies. It can vary widely, anywhere, and not everyone with these genes is 100% destined to develop Parkinson's. It's on the order of somewhere from 30 to 50%. And to further make things complicated, we know that some of these risk genes are associated with alpha-synuclein and some are not always. So GBA, people that have this GBA mutation and develop Parkinson's disease, nearly all of them have alpha-synuclein clumps in their brain. But about half of people with LRRK2 mutations that develop Parkinson's disease, only half of them have clumps of alpha-synuclein in their brain. So we think maybe alpha-synuclein is only relevant for half of those people and may not be relevant for the other half. So that's another piece of the puzzle that we're trying to figure out right now. And then the third bucket is, I think what you're getting to, Anne, is genes plus environment. So we know that there's a lot of things like brain injury, TBI, so traumatic brain injury, pesticides. So Tim Greenemeyer at Pittsburgh, he's been studying pesticides for a long time. So rotenone, for example, is one type of pesticide that's been associated with increasing your risk of Parkinson's disease. There are other things like air pollution has been associated with Parkinson's. And then actually I'll put this on here, but smoking, a moderate amount of smoking and caffeine use has been associated with decreasing your risk of Parkinson's disease. Yeah. Now we don't recommend smoking, of course, because you're putting yourself at a risk of a lot of other problems. But we think that there's probably some mix between your genetic background overall and then your exposure to different things over your lifetime that increases or decreases your risk for Parkinson's. And then there are other things like certain infections. So the flu virus, so the flu pandemic of in the 1920s, there were a lot of people that developed a disorder that looked like Parkinson's, and it's not clear whether that it's true, the same kind of Parkinson's disease we think of today. But it's interesting that sometimes an exposure itself can lead to Parkinson's disease. And I see this sometimes in people that come see me for the first time for diagnosis, is that when people were sick in the hospital for something else, like with COVID, some people said, yeah, I was shaking on one side, when I had COVID, or my family member noticed I was shaking in one arm, and then I got better and it went away, and now here I am, a couple of years later, and the shaking is back, and they look like they have Parkinson's disease. And so it's not I'm not sure that it's necessarily COVID or that illness that caused Parkinson's disease, but maybe it kind of unmasked the Parkinson's disease temporarily, and then when you got better, it was remasked, and then the disease progressed over time. But so maybe that's what was happening with the flu pandemic, or there were some people that it was truly causing a different kind of Parkinson's. And so all of that to say that my personal take on Parkinson's disease is that I think for a long time we've been calling everything that looks like Parkinson's disease, but maybe what we're really saying is that there is a phenotype or a way someone looks when they come into the clinic that is Parkinsonism, and then there are certain people that develop pathology related to alpha-synuclein, so clumping related to alpha-synuclein, and that's one way to get Parkinson's disease. Maybe there are different, other pathways to developing Parkinson's disease that are independent of alpha-synuclein. And so these are all things that we're trying to figure out now. So, I think stay tuned. I think it's really exciting now that we have some clinical tests for alpha-synuclein. We'll have a little bit more information about understanding how that's relevant, and maybe other pathways that are relevant. Some of these other things like traumatic brain injury, concussion, pesticides, air pollution all tie into developing Parkinson's disease. But it's complicated. It's very complicated.
It's a word that kept coming up in my mind as you were explaining all of these things, complications.
Yeah.
How important is it to, like at his stage, know whether or not it's one of the things that the doctor said was they tried what was the name of the medication? Cinemet, and it didn't seem to do anything. So then he stopped it, and so it's very confusing.
Yeah, so that's the tricky thing with what I said was vascular Parkinson's or Parkinson's, you look like you have Parkinson's because you had enough subclinical strokes. Most of those people will not respond to Sinemet. And if you have what we think about as classic Parkinson's disease, you should respond to Sinemet. I think it can be useful in terms of a prognosis to kind of figure out if you have alpha-synuclein dependent Parkinson's disease, because then it tells you that you would expect to get worse. People with vascular Parkinson's disease don't always get worse as long as you control everything else, like your risk factors. So stopping smoking, controlling your blood pressure, controlling your cholesterol, controlling diabetes, things like that. And then also, thinking about if you're interested in clinical trials, that's another reason to kind of really know whether this is alpha-synuclein dependent Parkinson's disease or not. Because now, so I think in the future we're going to have a lot of clinical trials now that will probably test for whether people have a problem with alpha-synuclein before you qualify for a clinical trial. We're actually already testing for these genes, LRRK2 and GBA, before we enroll people in some clinical trials. And there are even trials that are looking specifically for people with these mutations.
You said that Ashkenazi Jews are more likely to have this LRRK2.
Yes.
Is there a percentage?
I think it's somewhere on the order of like 1.5 to 2 times more likely to carry that mutation. You have a question?
When Tom was diagnosed last January by Dr. Gollum at Lankenau, I don't think we mentioned that he had a minor stroke 4 or 5 years ago, since we're here. Should we have done that?
I think it's useful to let him know, because sometimes if you're seeing a neurologist, they can also help you control your risk factors for stroke. But I think it also depends, if it depends where the stroke was. It also depends, if you're responding to medication, then I think it's already kind of telling that you probably have not just vascular Parkinsonism, that you have an underlying, probably classic Parkinson's disease too.
Another question, if I may. Should our kids be tested? Can they be tested?
So everyone can be tested you mean for Parkinson's?
Parkinson's.
You mean the genes, or do you mean for the alpha-synuclein?
Well, either or both.
Yeah, so I think from a genetic perspective, so the reasons that I recommend genetic testing for the patient, so for the person that has Parkinson's disease, is if they're under the age of 50, they have at least one direct family member, so parent, child, sibling that also has Parkinson's disease. Or they have the right ancestry. So if they're Ashkenazi Jewish, North African, I'll recommend that they get genetic testing. Otherwise, the genetic testing is not necessarily useful, because actually it's probably 10% or less of people that have Parkinson's disease that have an identifiable genetic change that we know of that increases their risk for Parkinson's. So the yield is very low, relatively speaking, unless you fit into those categories that I was talking about. And as for your children, unless they were to develop symptoms of Parkinson's disease, I don't think that the yield would be very high. But there are, you can talk to a genetic counselor and, pursue that testing. The question will be whether insurance will cover that testing or not, because it's not technically indicated from a clinical perspective. But just, for one person in the family having Parkinson's disease without you having symptoms, it increases your risk very, very slightly, but not, the risk goes up by on the order of like 10% or something like that. Yeah.
Doctor, can
George, Dr. George is fine too. Yeah, Dr. K. Dr. K or Dr. George is fine too. Yeah,
Okay. How does physical therapy help someone with Parkinson's?
Yeah, so there's kind of two separate answers to that question. So there's physical therapy and then there's exercise. So I'll touch on the exercise piece of it first. So exercise is the only thing that we know of that has shown to slow down Parkinson's disease. And we recommend aerobic exercise as the most beneficial. So that means anything that gets your heart rate up. So walking, running, swimming, biking, anything like that. And we recommend at least 30 minutes a day, at least 5 days out of the week. And we know that there's data that people with Parkinson's disease that exercise more frequently, progress more slowly, have less hospital visits than people that exercise less. And then the physical therapy piece of it, even if you're kind of early in your diagnosis of Parkinson's disease, the physical therapist can sometimes pick up on things, the way that you're walking, the way that you're, in the physical therapy center, they have simulated spaces like the kitchen, the car, things like that. They can watch you do things in and kind of give you advice on how to adjust so that you're able to do things for yourself better. And then also suggest safety things that you might not kind of think about automatically. And then, if you're not someone that has, been an avid exerciser your entire life, then the physical therapist can help you figure out how to exercise or suggest different ways to exercise. And then I think it's especially important if you're someone that is falling or you're having near falls, going to the physical therapist and learning exercises or making sure you don't need some sort of balance device, a cane or a walker to prevent falls. And then even doing having a therapist come to your home to evaluate how safe the home is. Because there's things that you don't think about, like different ledges or changes, when you go from one room to the other, if there's a difference in the height that you can trip on, different rugs, different types of stairs, safety in the bathroom, for example, showers that are hard to get in and bathtubs that are hard to get in and out of, having to stand in the bathroom, in the shower for a long period of time, can be an increased risk of falling. So that's, so all those reasons I think physical therapy is useful.
So you said exercise 30 minutes a day, 5 days a week.
At the minimum.
Okay. So do I infer that exercise is more important than physical therapy?
So I think it's hard for me to say that one is more important. We know that exercise slows down Parkinson's disease, and that's something that you can do by yourself generally, right? But physical therapy is certainly important, and it becomes more important if you're someone that's already falling or is having some near falls, right? Because if you fall and break a hip, right, that can be devastating for people over the age of 60.
I'm more concerned about my head.
Yeah, well, actually, falling and breaking a hip is actually more likely to cause harm. Causes harm more commonly than falling and hitting your head, especially people over the age of 60. Yeah. I think you have a question back there. Yeah.
Yes, please. You mentioned that, I think last time you were here, that you think very highly of the Michael J. Fox Foundation for Research. Is that the best organization to contribute to? I think recently, excuse me, I received something from, it didn't say Michael J. Fox, it just said Parkinson's Research, whatever.
Mm-hmm.
And I contributed to that.
Yeah, so I mean, I think there's kind of there's always like politics involved in all these different foundations and things like that. So I think the Michael J. Fox Foundation is traditionally the one that's been most active in terms of research, and that's what I meant last time. But the Parkinson's Foundation, the Michael J. Fox Foundation, there's also the Parkinson's and Movement Disorders Alliance. I think all of these organizations do great work, and they kind of have their own niche for what they do. So I think I think if you're contributing to any of those organizations, I think it's money well spent.
Oh,
You know, but and I think it just depends on what kinds of things you're interested in supporting, because they all do different things.
thank you.
We'll take your question and come back to you. Yeah.
Okay. I missed something when you were talking about the early indicators of Parkinson's. I got constipation and acting out dreams and sleep. What was the other one?
Loss of sense of smell.
Perfect. Thank you.
People have a tendency to go to the internet, learn what they can about anything. Is there one particular site about Parkinson's that is good and doesn't get into too much medical language that we wouldn't understand?
Yeah, so I think the Parkinson's Foundation website is probably one of the best in terms of things that you can read, and they have even lots of little very practical booklets and things like that that you can download. There's actually, I print off for a lot of my patients an exercise handout that they have on their website. It basically breaks down, they have the different types of exercise that have been shown to be beneficial for Parkinson's disease. So aerobic exercise, stretching, balance, weight training, and kind of gives you an idea of how to divide your 5 days out of the week, for example, into those different categories. They also have resources on the basics of understanding Parkinson's disease, what to do if you have to go to the hospital with Parkinson's disease, and having a kit that you can, they actually have kits for going to the hospital, and so even if you go in a rush, you can have a kit handy so that all your medicines, the instructions for how you take your medicines, all that stuff is ready to go. Because often in an emergency situation, you don't have time to prepare all those things, and when you get to the hospital, things get lost in translation.
Parkinson's Foundation.
Parkinson's Foundation, yeah.
And they have some programs that you can sign up for, exercise programs, and do right along with videos. It's a huge long list of resources. I recommend both of those, Fox for research and the Foundation for resources.
Yeah.
So both of those are excellent. If we have this long name, Parkinson's and Movement Disorders Group. Should we just be the Parkinsonians?
I mean, it's up to you and how inclusive or exclusive you want to be. Because I think there's also like a lot of great questions here today about, uncertainty about diagnosis and things like that, right?
Yeah.
So it's not just about, whether you have the label of Parkinson's or not, but trying to figure out, trying to get advice on how to figure out.
Keep in that movement disorders.
I think that's reasonable, yeah.
Okay.
Dr. Kay, why would one neurologist tell us that Tom did not have Parkinson's, and then someone here who has had Parkinson's for years suggested we take him to Dr. Gollum, who diagnosed it as Parkinson's?
So I think without knowing the full story, there's a lot of different reasons that it may happen. One is Dr. Gollum had the advantage of probably seeing you later in time, right? So maybe the symptoms were a little bit more obvious. But I think even for some neurologists, early Parkinson's disease can be very tricky to diagnose. And it can be really subtle. Even if you feel like you're having symptoms, it can sometimes be externally difficult to see. And then, I think if so there's the part about, what symptoms there are to see, to observe, education and experience about Parkinson's disease, right? I mean, that's why, I've spent an additional 2 years after neurology residency to learn how to diagnose and treat Parkinson's disease, right? So it's not something that's, I think, easy to do all the time. And yeah, so I think those maybe, and then also just some symptoms fluctuate, as you guys know, from day to day, for even hour by hour. So if you looked really good and at the time that you were in the doctor's office, I think it may have been more difficult to diagnose.
Well, Tom had the tremors, and he called them, the first off, the neurologist, essential
Essential
tremors.
tremor.
Yeah, and then when he was diagnosed, it really annoyed me that he hadn't been diagnosed earlier.
Yeah.
Yeah.
It's tricky. We see that a lot. Sometimes people, it takes a few years before they get the official diagnosis. Suzanne.
Thank you.
Two questions. Am I correct in assuming that the alpha-synuclein thing is only of value if you have the genetic one?
Nope. So even if you don't have the genetic form, it can be helpful, especially if the symptoms, may be a little bit unclear or uncertain in diagnosing Parkinson's disease. So sometimes we'll have people that may have multiple reasons for having trouble with walking. I think one of the most common reasons is people that have had a lot of subclinical strokes. And this test can be helpful, and especially knowing how hard to push with trying different medications or other therapies.
To rule out the genetic one?
It doesn't rule out the genetic forms. You'd have to do specific genetic testing for that, but it helps clarify. It helps rule in the diagnosis of Parkinson's disease. It doesn't rule out the genetic forms, though.
And do the very early symptoms also show up in other types of Parkinson's?
No, not always. So.
Or those genetically earlier?
So for some of the genetic forms, you do have those early symptoms, and for some of the genetic forms, you don't.
And what about the other groups? Do those have that kind of early symptoms?
So we think for group 3, this is probably the most common. This is what I think about as classic Parkinson's disease. But for group 4, where it's really just an exposure that causes something that looks like Parkinson's disease, it's kind of like you're exposed and you develop Parkinson's disease. So the people that had that MPTP exposure from the contaminated heroin, they use the drug and then develop Parkinson's disease right away. Or flu, they got the flu in the 1920s and they developed Parkinson's right away. And actually, HIV is another one that can cause Parkinson's. And so people that have untreated HIV can develop something that looks like Parkinson's. And then you treat their HIV and it gets better.
Would you comment on medical marijuana and Parkinson's? This is from Marty's brother, by the way.
So medical and otherwise non-medical marijuana, I think it's a tricky subject in medicine in general because, we've kind of increased access to marijuana very readily, but it's still very difficult to study because there's a lot of legal issues around actually studying it in the lab, for example. And then also kind of figuring out what are all the different components in marijuana doing. From the data that does exist, we know that marijuana that contains more CBD compared to THC tends to be more helpful for Parkinson's disease. And it tends to be most helpful for actually the non-motor symptoms of Parkinson's disease. And so that means things like mood, pain, sleep, rather than the actual motor symptoms of Parkinson's disease. If you're going to use medical marijuana, then I would recommend trying to get something has more CBD compared to THC, and then just keep in mind that it's probably going to be more helpful for your non-motor symptoms rather than your movement symptoms. I think you had a question.
My grandfather had Parkinson's and my mother had Parkinson's. So about 5 years ago or so, I got myself tested and they said I don't have the gene. But I have been part of the Michael J. Fox, I don't know what you would call me. I answered the questionnaires.
Are you part of the PPMI study maybe?
I
Does that
guess
sound right?
it's, like they send me questions and I answer them, and I don't know whether I'm helpful or not, but I have noticed that they have other desires to have people like my husband be part of these studies, and I'm wondering, it's hard to convince him, but wouldn't it be a good idea if he, contributed in that way?
I mean, I think it's up to you. I think when in terms of participating in research, it's such a personal decision, right? Because it's I kind of think about it as the decision to like eat to be eco-friendly, right? Like how eco-friendly can you be, right? Like it depends how much you want to do. I mean, sometimes just dealing with the diagnosis of Parkinson's disease is a lot for some people, and that's just, they don't want to do anything else. You just need to focus on yourself and take care of yourself, and there's nothing wrong with that. But then there's some people that I want to be a part of research. I want to be involved with these organizations, and that's what they want to do. So I think neither response is wrong, but it really just depends on what you feel like doing and feel like participating in. But if you want to talk specifically about details of any of those studies, so like I actually do procedures for the PPMI study at Penn, and participate in a few other clinical trials as well. So always happy to chat about those things. Yeah.
Have you been aware of the work that's been done with respect to the effects of near-infrared light on physiology and on possible improvement of things, perhaps in the same vein as exercise? Is that something that you have heard about?
I've heard about it. I haven't looked closely at the studies that have been done with near-infrared light. So I can't comment on how robust that data is.
Would you be interested in looking at some references?
Yeah, absolutely. Yeah. You can, if you want to send them via Ann, I'm happy to take a look at them.
I've got those. I'll send them on to you.
Yeah, I mean, my motto is, if anything is not harmful and potentially helpful, I think go for it. I think the only thing I warn people is something may not be medically harmful, but if it's harmful to your pocketbook, I think also just keep that in mind.
A friend's brother had been diagnosed with Lewy bodies, but I don't know that he did die kind of from it, basically because he kept falling. But I don't know that we ever knew that he had other kinds of tremors or anything. Can you have those separate?
Yeah, so I think what you're referring to is the disease called dementia with Lewy bodies. And so I think about that as on a spectrum, with Parkinson's disease on one end and dementia with Lewy bodies on one end. And I think it's not necessarily the same disease, but it kind of, again, for reasons we don't completely understand, manifests differently in different people. So about half of people with Parkinson's disease will develop dementia at some point in the course of their disease. But people with dementia with Lewy bodies, they develop dementia very early and then develop symptoms of movement that look like Parkinson's disease. So there's this kind of big spectrum of when do you develop trouble with thinking and memory. Early, so never, versus very, very early. And actually, if you look under the microscope at the brains of people that have dementia with Lewy bodies and Parkinson's disease with dementia, when they die, you can't tell them apart. So at the end, the pathologic process is very overlapping, is very similar. So all of that to say that that's also the difficulty in studying Parkinson's disease. It can look very different from one person to the next. So I see people that have no tremor and they never really have tremor the entire time they have Parkinson's disease. Whereas there are some people that tremor is the most bothersome symptom and everything else is very manageable. I have a couple of people actually that their mood symptoms, so depression, the anxiety, that is so disabling that they don't care about the movement symptoms. They have very mild movement symptoms, but they can't go out and do anything because their depression and anxiety is so bad. So this is, this is why it's also very difficult to study Parkinson's, because it can look very different from one person to the next.
His, the brother's son just died of ALS. Is there any connection?
So there are some genetic forms of, so ALS, which is Lou Gehrig's disease, and frontotemporal dementia. So that's another disease where there's kind of a spectrum between those two diseases. And there are forms that can cause something that looks like Parkinson's disease. So I would, for that family, I would be very interested to see. Genetic testing, I think, would be very important.
Well, she's talking about my family. I don't know, my parents did not have, well, my mother died at a young age from a stroke, but my father lived to 86 and he had nothing like Parkinson's.
But he had dementia.
He had dementia. I can't think of any persons in the direct line that had Parkinson's, no. So I don't know what the genetic component is of what I'm supposed to be having.
Right. And I think it's certainly something to talk to your doctor about if you haven't.
Good. More? All set?
Thank you.
We need to let you go by 11, and I think we're there. Thank you so much.
No problem.
Think
I'm
we-
always happy to come. And I think for next time, you can maybe Ann just gather